Welcome to Harnessing AI in Public Health, Applying the Tools and Navigating the Pitfalls. My name is Merlene Tucker, and I'll be running this Dialogue for Health web forum along with my colleague Jeff Bornstein. Thank you to our partner for today's event, the Public Health Institute. Now it is my pleasure to introduce the moderator of today's event, Dr. Carmen Rita Nevares. Carmen is a senior advisor at PHI Center for Health Leadership and Impact, founder of Dialogue for Health, and senior vice president emeritus of External Relations and Preventive Medicine at the Public Health Institute. Welcome, Carmen.
Thank you, Merlene. Welcome to all of our audience and welcome to our speakers. This is a great opportunity for us to further our dialogue around artificial intelligence. And as for those of you who've been in the first, you know there are three, this is our second. The artificial intelligence really has the potential to reshape the landscape of public health, from data modernization and predictive analytics to ethical policy development and community engagement. We went over some of that in our first webinar, which was a little bit more on the conceptual side. So today we're going to dig in and really look at how AI has been implemented, where people are going with it, hear your questions and your issues around what we should be doing when we're trying to think about what does AI on the ground look like. So let me tell you a little bit about the speakers. We are really happy to have today with us Dr. Philip Huang and Tatiana Lin. So let me tell you first about Phil. He served as the Director and Health Authority for Dallas County Health and Human Services for the last 6 years, after serving for 11 years as the Medical Director and Health Authority for Austin Public Health. He's a bachelor's in civil engineering, an MD from UT Southwest Medical School, and an MPH from Harvard Health Policy and Management. In his role as Director of Health and Human Services, he's recognized as an innovator in cutting-edge implementation of AI tools for a variety of public health functions. Recognized nationally, he was named as one of Governing Magazine's Public Officials of the Year for 2024. Tatiana Lin has a master's degree and is the Director of Business Strategy and Innovation at the Kansas Health Institute, advancing partnerships across public, private, and philanthropic sectors. She has more than a decade of public health experience and is a recognized leader in health and all policies, health impact assessment, behavioral health, and crisis standards of care. She's also recognized nationally for her leadership at the intersection of public health and artificial intelligence. She led the development of developing AI policies for public health organizations, a template and guidance, and has held workshops and technical assistance to really further the implementation of those policies, and is a co-author of the American Public Health Association's policy on AI in the workforce. In 2025, she received the Public Health Innovation Award from the National Network of Public Health Institutes in recognition for her work on artificial intelligence. So we have a very knowledgeable panel of speakers today, and I'm really hoping we can take this into some great new and interesting ground as we get into where we want to go on the webinar today. So what I wanted to do was to really have our speakers introduce themselves in a meaningful way, give us a better idea of who they are, and tell the audience a little bit about the organizations that they lead and their missions, and give us a bit of a, oh, excuse me, I am so sorry, I have skipped ahead of myself. So before I do ask the speakers to speak a little bit to what they are specifically doing and their span of control, I want to go ahead and give us a video, a welcome from our CEO at Public Health Institute. Can you roll the video?
Good morning, everyone, and welcome to our second webinar in the series on AI in public health, harnessing AI in public health, applying the tools, and navigating the pitfalls. We're thrilled to have you join us for the second installment in our series, exploring how artificial intelligence is transforming public health research and practice. In our first session, we explored the promise of AI in amplifying our ability to meet community needs. Today, we're building on that foundation with a deeper dive into how AI is being applied in real-world public health settings. This session will focus on practical applications, emerging trends, and the ethical and operational challenges that come with integrating AI into public health systems and research. You'll hear directly from leaders who are navigating these issues on the ground. We're honored to be joined by two distinguished speakers, Dr. Phil Huang, Director of Health and Human Services for Dallas County, and Tatiana Lin, Director of Business Strategy and Innovation at the Kansas Health Institute. Each brings a unique perspective from policy and ethics to implementation and innovation. I encourage you to participate actively in the webinar, submit your questions in the Q&A box throughout the session. There will also be a third webinar in the series in early 2026. With that, let's begin today's conversation on how AI is shaping the future of public health and what we need to consider to use it responsibly and effectively. And with that, I'll turn it over to today's moderator, Dr. Carmen Nevarez.
Thank you for reminding me. I know that that Melissa has been following the series very closely. She was really unhappy to not be able to join us live today, but we asked her to put together a little welcome, which she nicely did. So back to the self-introduction. This is really, I think, in a lot of ways, the core of you, the audience, understanding how rich the speakers are and the backgrounds that they bring to us. So please, let's start with Phil. Let's talk a little bit. Let's have you talk a little bit about what you do, what kind of organization you have, and let us know about the diversity of applications where you have been using AI in order for the audience to see what you bring to this discussion.
Sure. Well, thank you, Carmen, and it's an honor to be on here. And I do want to mention up front, I'm really glad to be on with Tatiana Lin. I really respect the great work that she and the Kansas Health Institute are doing on AI. And, so I'm just a local health department director trying to implement this stuff at the, local level. But, she's got so much expertise on what's being done. But a little background on myself. So next slide. I am the director of the Dallas County Health and Human Services Department. And so Dallas County, we're in Dallas, Texas, but we actually serve over 2.6 million residents of Dallas County. We have, so it's not, and we're a county that has 31 different municipalities, of which City of Dallas is just one. So it's a big, diverse group. It's, and I will point out, the population we serve is actually bigger than 15 states. So a lot of focus on data modernization and things has been at the state level, but we try to point out that so much is happening at the local level, and in terms of local health departments, many of us are larger even than entire states. And so, the scope of what we do at the local health department goes, it's a full functioning local health and also human services, which adds a new dimension to some of those things that we are very consciously trying to bring the use of the human services and social services to impact public health. So we do things like emergency preparedness, epidemiology, outbreak investigations, all the standard things for public health that, obviously have multiple potential applications for AI. And then, so our budget of our department's about $337 million. And we have almost 700 FTEs. So we've got, it's a great health department with a great team working in so many different areas. And we're just, on the ground level trying to do what we can with the data modernization and even an application of AI. So next slide. One of the things that I just wanted to mention, in particular, we've been doing a lot with data modernization. And since COVID, it showed the importance of modernizing our public health data systems, because we were literally, had med students with stacks of paper faxes of lab reports that were entering manually in to get COVID counts every day and analyze these things. And COVID showed how important it was to have timely and accurate data, and how deficient some of these systems were. So this is sort of one of the big things that we've been doing is with our data modernization. We call it our disease analytics and localized intervention and surveillance system to bring in a lot of this electronic data. And this is sort of the schematic of the architecture that, on the left side, you can see all the different data sources that we're now bringing in electronically. So this is electronic lab reports from the state. We've been working with electronic case reports from the hospitals and electronic health record systems, mortality data and vital records. We've been bringing in our immunization registry data. We've actually just started bringing in homeless management information system, and then some of the other closed cases from the state disease investigation system. And we're trying to broaden it now to also include HIV, STIs, all these things that we're bringing in to an Informatica centralized master data management system to, to deduplicate, match and merge records, to address validation, and use these tools that in the software that are currently available. But it's sort of a direct, some of those are direct, like mapping of data fields and things like that. And then we're using Salesforce to do our investigations so that we could stand up hundreds of contact tracers in an instant. But also Salesforce has a lot of data visualizations, reports. We're using now integrating Salesforce maps to get GIS visualization on cases. But then the other piece of it is the CRM capabilities of Salesforce to do messaging and automate those messaging and do messaging journeys, using text messaging and email, or even social media advertisements, and incorporating that into our whole disease surveillance investigation system. And I bring this up because this is sort of a core of some of the applications that we're looking at with AI from the standpoint, we're using some large enterprise level software like Informatica and Salesforce that have AI features built into it. And so we're looking, and we're still in the infancy stages, but to use some of the AI capabilities of these software products to help with matching and merging and deduplication and mapping of our data, or with the messaging and communications and things with Salesforce, to use the data that we have on the individuals or social determinant data to customize messaging, and so with text messages or emails or some of those things, to take advantage of the AI features in Salesforce. They have a new thing called Agent Force, which is their application of AI, and looking at doing some of the things within that that they're developing, or working with them again in communication and other data processing. So that's why I wanted to show this as a core of some of the activities we're working on. Some of them we haven't fully implemented, but this is where we're going. Next slide is just, and I will mention, I've had the opportunity to do some presentations on AI over the last year and a half, at NACHO and CSTE and APHA. And over time, it's really interesting because, we start out and say, how many of you have even downloaded ChatGPT or are using this? And so each time there's been more and more health departments, staff and people that are showing that they're participating or have at least downloaded ChatGPT. But I was surprised, even, fairly recent, there's still a lot of people that haven't even done that. And I say, if you do one thing after this, at least download the, app and start playing around with it. But these are some of the sort of high level issues I'm sure we'll talk about more in applications, and Tatiana will go through a lot more detail and things. But, just text generation, and, we use it to draft correspondence and, grant writing. If we say, hey, we need this sort of section to address some of these issues, and you can, feed it some information, like information processing. For us at a county level, we get a lot of court orders and things like that. We can pop those into ChatGPT and say, summarize these court orders, or do some other reports on that, or state legislation, or things like that. And then, as I mentioned, some of the health communication type of things that we're doing, the using CRM, but we're looking, and one thing I'll mention is a sort of background for us at Dallas County, that we're a health department in the county government. So we have county level IT, and there's a new county level CIO that's now trying to do more county-wide sort of implementation of AI, but also the policies and things were very dependent on that. So, we're looking at and talking to them about AI-driven chatbots that, would be a closed large language model that we would populate with the information that we want people to draw from for their chatbot questions and the answers and things like that. And language translation, again, I think AI is doing great with language translation. So with that CRM application that we talked about, doing that. And then, with the health informatics and disease surveillance, I mentioned some of the natural language processing, data integration and management, tracking systems. And as we're building the surveillance system and getting all this data, part of what we're very interested in, and we're working with some of the funded sites at University of Texas at Austin, who's doing the EpiEngage program for predictive modeling that's funded by CDC. And so some of that predictive analytics, we've had staff that have used it to write code, whether in Excel or other program languages, some scenario analysis and things. And then I think we're going to also specifically talk about some of the ethical and privacy considerations later. But that's just very high level, overview of the type of things we're doing. Again, I'm on the ground at a local health department, and we'll have the perspective of what we're doing, just trying to sort out everything with this. And the last slide I had was just some references that I found useful that are out there. There's more information. John Auerbach and his team just published an article in Journal of Public Health Management and Practice on AI and public health enterprise. There was some other articles in Journal of Public Health Management and Practice. And then also I've referred to the NACO, National Association of Counties, their AI County Compass. It's sort of a toolkit for local governance to implement AI, which I thought was practical. And then again, Tatiana and her team at Kansas Health Institute's resources are tremendous. So let me stop there. That's sort of where my perspective is as we keep talking about this, where I'll be talking from.
That's really helpful. It'll give our audience a good sense of what kinds of areas in which you have specific experience. And maybe as we get into it, you can talk a little bit about where you think AI implementation areas that you haven't tapped yet, what those areas might be. So Tatiana, let's have you also introduce yourself and what you do, and talk a little bit about what your thoughts are.
Thank you. It's a pleasure to be here, and thank you to the audience for joining this webinar today. And I always appreciate hearing from Phil and his insights on the ground. And so my name is Tatiana Lin, and I'm a Director of Business Strategy and Innovation. And I am a part of the Kansas Health Institute, which is one of the public health institutes. There are 50 public health institutes in the country, and we are a member of National Network of Public Health Institutes as well. And so if you do next slide. So just to give you a context where we come into this work in AI and our work with local, county, and state governmental public health, our institute has been involved for a decade in this work. Maybe some of you remember Multi-State Learning Collaborative under Robert Wood Johnson Foundation, when we worked on quality improvement, performance management. We also had the pleasure of being a part of the Center for Public Health Sharing Services, co-leading this effort, which is now on the public health accreditation work. This great work continues. And most recently, we are been very fortunate to be part of the Public Health Infrastructure Grant, specifically Technical Assistance Hub for Region 7. And that's where our work with AI lives quite a bit. We are working in a kind of a data modernization arm of FIG and being able to provide assistance with some AI capacity building and AI policy development to grantees of public health infrastructure grants. So why did we engage in AI? As we were looking at this about 3 years ago, our mission is to improve the health of Kansans. We believe in doing it through nonpartisan research, education, and engagement. And we felt that AI presents some new opportunities for public health. We know AI is not new. It's been around since the 1950s, when the term AI was coined by McCarthy. But at the same time, there's this renewed energy in just more accessible AI applications for all, including public health. And so we felt that we as an institute can play a role in contributing this conversation and help public health community to engage in AI in responsible ways. So our 4 pillars of working on AI is importance of partnership. And here I have partnership specifically. I want to highlight our partners, Aaron Davis, Wichita State University Community Engagement Institute, our FIG partners. But in addition, one of our pillars is partnering also in thinking how we can partner with a private sector, because a lot of AI development does happen in the private sector. So these partnerships are very important. Focus on capacity building is also critical, because as we were doing the workshops, and we recognized there is a lot of need in AI literacy building and knowledge and just comfortable and even understanding what's going on in the AI space in public health. Of course, we felt the importance of AI governance model and AI policy development, and I'll show the QR code for our resource that we developed with partners with Health Resources in Action, Wichita State University, and also FIG. And then co-creation of solutions with communities. I hope we'll have an opportunity to talk a little bit about that, because this is really important to make sure that we figuring out as a public health how these AI solutions can be co-created, how we can help private sector to co-create them with the communities. And so Dr. Navarez already shared some of the examples of our work, but just want to maybe mention the ones that to add to the list. So we've been also leading a community of practice with an NPHI for public health institutes and also in Kansas. And another thing that we found our role is creating a list of use cases in public health and help to disseminate them widely, because right now they live in a different systems within different organizations, and really fleshing out and connecting our public health community to those use cases to show the potential. We found that to be a very meaningful role for the Health Institute. Next slide. So this is the resource, the AI template and guidance, and I appreciate for both Dr. Navarez and for Phil to mentioning that. What is different about this resource? We believe that this is specifically for public health organizations, and it is based on literature and policy review. You can scan QR code. We'll also post a link to the chat later or make it available to you. And what it does is it helps you set an effective and strong way to start your AI policy development, because it can be really difficult to know what to include in your policy. So it walks you through some pre-requirements, what could be helpful, like how you build your team, how you think about change management, how you even know if AI is the right tool, because we don't need AI for every solution. So it might be a good solution, might be not, depending on your case. And then it provides a sample of provisions that you can adapt. So it really shows what sections you can include in your AI policy, in what subsample language you can include and adapt. And so we hope that you can find this resource helpful, but we'll mention a couple parts of this resource in our conversation today. Next slide. Just to give you a sense where we've been so far, and so this is the map that kind of shows the span of our activity in the trainings we have been doing with Aaron Davis, Wichita State University Community Engagement Institute. And a lot of those trainings been done through public health infrastructure grants. So we have done 55 trainings in the last year, just over 40, and they span different needs, span AI literacy, how to think about ethical guidelines, environmental guidelines for AI, how to think about prompt engineering, and it spans, as you can see, different parts of the country, including territories. So what I think one takeaway from this map for me is always there's so much need. And so I hope if there's other organizations on the call that providing or could provide this type of trainings, I think there is definitely a lot of appetite for those. And I think with that, it completes my introduction, and we can move, Carmen, back to you.
Great, thank you, Tatiana. I think that both of you did a really nice job of giving us an overview of what your current engagement is, and given what you've been talking about, maybe Phil, let's start with you. I'd like to know what you're thinking are the most exciting areas, the areas where you're finding that AI has already given you some very good, solid, grounded footing. and where you think you've been the most productive so far in your work?
Yeah, well, so far the things that are so helpful already, as I mentioned, drafting correspondence, help with grant writing, analysis of reports. And I saw in the questions and answers, there was a question about, I mentioned putting in some of our court orders. And that is one thing, we make sure that understand, and that was one thing I told on a town hall meeting with all of our staff, anything you put into ChatGPT is public, and to always treat it like that. But court orders for us are public documents. They're published on the county commissioner's website with the agendas. So that is all public information. So in particular, and when I analyze legislation, that comes up. So those are definitely some of the bread and butter type of things that we're doing. And as we get more into, I mentioned the communication opportunities and using AI to really customize those messaging. It's just there's so much opportunity with that. And then the other area in particular for us with disease control and investigation, the opportunities with predictive modeling and really taking so much, all of the information that we're getting from different sources and synthesizing it to give us the best sort of predictive modeling or information that we can to protect from some of these communicable diseases and other things that we're dealing with at the front lines. The other thing that we're really close to, I think, and probably Tatiana will give examples of these, are just that I mentioned the chat bots, and for us to really save time by having a closed LLM that we can control what data goes into that, and then that is where then people can query it. It could be internal for staff, or it can be public facing. So when people have questions about our programs or whatever, they get answers, and it could really save a lot of time and staff time and things like that.
So let me just go back to something you mentioned. When you were talking about customizing messaging, can you be a little bit more specific about that? Do you mean what you were just referring to? Were you using specific answers to go into chat box? Were you also thinking of some other things?
So really, a lot of that was what I mentioned in the first sort of schematic of our disease surveillance system, where we're using Salesforce so we get all of the reportable conditions, and that we have now the opportunity that we haven't taken advantage of as much, to disseminate information, about perhaps the disease that they just tested positive for, or to link them to other resources, because we're also bringing in social determinant and social determinant needs, a profile based on their home address, and then the census block that they live in. What proportion have food access problems or other things, or language? And so we can customize, again, I think the translation capabilities now with AI are really getting so much better. You can do some language translation in those messaging. You can customize it based on some of the social determinants that they have, or other things to make it culturally appropriate. And as we'll talk about concerns, to make sure that it is actually being based on data that's will be accurate in those cultural interpretations and things, and be culturally sensitive. But that's where I think there's the communication opportunities in addition in that way. Yeah.
Oh, that's really helpful. Tatiana, you want to talk a little bit about what you think are some of the real cutting edge, exciting and productive areas where you're seeing AI being implemented?
Do so. Well, I think there's so many different exciting opportunities right now that's already happening in public health, and I'm probably not going to do the full justice of naming all of them, but hopefully we'll touch base on the main ones. So we know that there are some platforms that's been developed and already in use, for example, for informing emergency preparedness, to help in really with these tabletop exercises that can take a lot of time to develop and do. So, for example, Johnson's name, Prepper AI, is, I know it's one of the potential vendors that have been doing this work. And so other ones that I think very exciting is also with NORC, University of Chicago. They're doing some great work in helping with public health communication, especially figuring out how to identify misinformation and understand how it spreads across the communities. I think other applications are with RTI International, one that really picked, and I think it can be helpful for public health organizations, as we're always trying to figure out how do we know that readers of our information that we distribute, what do they read, what resonates with them when we share that. So they're developing a tool that is called predictive eye tracking. And this particular tool allows to, the program allows to scan text as well as images and to suggest layout adjustments. And so it can really keep audience focused on the main messages. And so ideas like that can really, I think, help with some of that outreach in making it effective. But the other one that you can see on the screen where when I think about, the power of AI is the power of, and then Phil mentioned that, of predictive analytics and forecasting. What can they really do? I think one quote from the former CDC officer, Director Bill Foyge, that resonates with me is public health is at its best when we predict and prevent and not just react or respond. And so one of the interesting cases in disease surveillance or examples is a blue dot, and I heard we have somebody online from Canada. And so this is actually a Canadian platform developed in Canada. They use the machine learning natural language processing to generally scan reports, all the media reports globally in 130 languages and every 15 minutes, but where it's really had that case of disease surveillance during the COVID-19 pandemic, where they were able, issue alerts even before we received the official kind of notification, and they were also being able to use global airline ticketing data to say which city is going to experience the highest, number of individuals with those cases. And so another, I think, example of disease surveillance is also, we know that importance of mortality and cause of death data. And MedCoder, developed by CDC, is an example of, I think, this innovative AI solutions that uses natural language processing as well as machine learning to automate the first pass of this coding process. And so it allows to, even with the messy information, to match it with IDC, 10 codes, and being able to really reduce that time that's required to do that in a more manual way. Of course, human in the loop is really essential to that. Need to go to the next slide. So another one that I want to share with that kind of in the spirit of predictive modeling and forecasting, which also I think very exciting for public health, comes from Johns Hopkins Applied Physics Lab and National Oceanic Atmospheric Administration. So they used AI systems to improve wildfire smoke forecasting. And we know in public health, environmental health, it's very important to alert people when there is, poor air conditions, so they can take necessary measures. And so if you're in that space, you know that traditional air quality models are slower in the process and required to do calculation of hundreds of pollutants and run many different model versions. And so by using the deep learning model, we're able to really speed up the process. And instead of running thousands of weather models, predict how the smoke and pollutants will actually move through the air. And then they allow to create forecasts that were kind of earlier, higher resolution, and more accurate to tell people about the dangerous weather conditions. Another, I think, pretty exciting example comes from Chicago Department of Public Health, as we all trying to figure out how to address, dangerous diseases like West Nile virus. So Department of Chicago Department of Public Health and Department of Innovation and Technology, they used a machine learning model to predict which neighborhoods are most likely to be at risk of mosquito starts before mosquito actually start testing positive. And what they did for that, they used trap data, weather information, historical outbreak data, patterns to build a system that can actually suggest before the virus, Nile virus appear like a week in advance. And what was the interesting case for that or used for that is being able to specifically target, the neighborhoods and spray there with more of a, with the resources in mind versus going across all the areas. They identified that it was 80% accurate, that particular model, and they also integrated that with their larger windy grid platform for staff getting alerts. One of my other examples from Chicago department as we're thinking about promising is food inspections. Now a lot of public health organizations do food inspections. And so they also use natural language processing and to understand, first of all, where would the historical data, so where would the inspections, likely be needed or should be prioritized based where there might be kind of reoccurrence of that food violations. But they also use this natural language processing, which is really good to understand that non-structural text, to understand where typically those violations occur. So what areas of the food establishments. And you can see here a word cloud where the findings were it can be in rear storage, produce prep areas, storage areas. So the functionality of the data and being able for inspectors to really focus on the certain areas when they come to the food establishments. One thing to keep in mind when we talk about historical data, that it can potentially have some bias. And so because some of the restaurants might be overrepresented due to certain reasons. And so making sure that the model that AI is using is offsets and addresses that bias. And lastly, thinking about AI agents, I think there are so many different AI agents that can really help to support the work of public health departments. We know we talked about the chatbots, and Phil mentioned some of the chatbots that they have experiencing. Layla Got You is one of the chatbots in New York, and it was specifically for sensitive contraception information dissemination to a younger population. What I think is interesting about this case that it was co-developed with the community, so they helped to understand and make that really, really effective for the audience and engaging, but also providers and evidence-based information to verifying this. Other AI agents can be taking clinical notes in the room with the patients, or as well as translating, like Pocket Talk and Johnson County Department of Health and Environment is using that to translate it during vaccination clinics to support, immigrant population, those who English is not a native language or secondary language. But one thing I want to mention about this agent I'm using for clinical notes, what we need to wrestle with is, should that be consent form from the patient to sign, before those used? So there are some ethical considerations of using some of those AI systems in the patient setting. So I will pause there and see if there are any other questions.
Super. There was a good question here. Somebody wants to know the name of the software that you mentioned for tabletop emergency exercises. Could you repeat that?
Yes, it's called Prepper AI. And I will spell it because there's a couple different preppers. So I will put it in the chat, and I think Marlene will put it for everyone.
Great, thank you, thank you. So I'm getting some really good questions from the audience, and I just want you to know I'm reading them, and I'll be kind of finding the best way to get all of your questions back into our speaker, over to our experts here. Let me ask a little bit about, because this is something that's coming up a lot for the audience. There are a lot of questions about governance, and I want to get into that in just a little bit. But before we get into governance, how can you talk a little bit about how public health workers can start to prepare themselves to take advantage of the potential that AI offers? And think a little bit about, are there policymaker issues, are there privacy issues, are there community issues that you've heard about, and what what are some of the what are some of the ways to mitigate concerns or to amplify the usefulness from those perspectives? So Tatiana, why don't you go first, and then we'll hear from you, Phil.
Awesome, such an important question. So there are multiple opportunities there. So one thing I think to think about is building AI literacy, which I think is important because it helps you to understand what are some what are we talking about when we're talking about AI? And then what are some use cases, what some do and don'ts, and what we can explore. And so that AI literacy would be probably best built about, yes, you can attend those types of webinars, but also try to bring it to your organization and even maybe setting up the book club or the work group within the organization. So you can do this really working with each other and share resources, share little pilots that you are doing on an individual level, lessons learned, and keeping track of those. The second part, I think, more on organizational wide is small scale pilots. And small scale pilots can be really helpful to start getting comfortable with AI, even with some of the publicly accessible tools, with the idea that it has to be, of course, managed to make sure that you're only using it, public information, that you are not, putting anything that's private in those chats. But as you set up those pilots, you can think about the tasks that maybe are painful, that takes a lot of time, and would be a good candidate for using AI solutions for. And so one other thing that I would like to suggest in the pilots, if you set up a pilot, to set up a measures. And the measures are very helpful because you want to understand if AI even adds value. And this is the slide here that have some, just suggestions for the measures. So what you want to understand in those pilots is, did it save time? Because we're trying to gain efficiencies with using AI. How accurate was the use? Because we want to make sure that outputs are accurate and, going and redoing a lot of work. And then also how helpful overall this for the staff. And this is just an example of the measures that you can consider if you're setting up those pilots. There can be, of course, other ones, but that's something you can agree within the organization what those measures could be. And then another potential avenue to getting comfortable with that is to make sure that you are working with the policymakers and trying to understand what their concerns are. So working with the policymakers and communities and engaging them in that conversation about AI. So they also have exposure about where some potential opportunities are for the health department, but also hearing from the community, what community is concerned about using AI and bringing that up to the conversation and to your solutions. So I think both of those aspects could be very important. So start small, and then as you feel more comfortable, scaling up can be a way to go.
Great. Phil, you want to jump into that question?
Yeah, no, I mean, I think Tatiana covered it so well. I just agree, starting small and building that literacy. I know our School of Public Health, we're an academic health department with UT Southwestern School of Public Health, and they have now integrated AI into required curriculum for all of their graduates. So that's something that I've recently seen, and we're trying to make it more available to our staff. But then also, again, starting small. I just try to encourage people to, on their own, play around with ChatGPT or just to start to understand some of the capabilities with this. But with that caveat, again, anything you put in there should be public and considered public. There was a comment in the questions regarding that I mentioned using it for grant writing, and someone reviews grants or something said, "Oh, they're all going to start looking the same." I mean, we customize that, with our own information, so it's not, it's really not just some generic response, but it helps us, I think, bring together information about some of the work that we've done and give a first draft of maybe a paragraph that might better describe all of our activities that we might want to convey in a grant application. But I certainly understand that concern. But it's and as Tatiana has mentioned, the human in the loop is a key for everything in terms of just ensuring the validity and not hallucinations and things like that. That I know Monica Burrell, who's was, I think, Commissioner of Massachusetts and now is with Google Health. I was on a couple of sessions with her, and she talks about it, treat it like a superstar intern. And, you've got a great intern working and doing all this work for you, but you're not just going to put out their stuff without reviewing it or looking at it. And that's what we try to think of it. It's a tool that really helps save us already so much time, even with these small sort of use cases. But I agree, just, start small and larger, implementations, that's where we're getting into the discussions with our county IT department and others for that broader implementation.
So one of the things that comes up over and over again, and I think, Phil, I heard you do a very nice presentation on this, had to do with the framework, the infrastructure for governance. Maybe let's talk a little bit about what kinds of concerns and what kinds of planning should a department institute when they're thinking about AI in order to make sure that that they've decided what the standards are that need to be for its implementation, so that they can also address concerns that might be raised by their community, or address concerns that could be raised by their policymakers. So what kind of a governance infrastructure, how do you go about setting up a governance infrastructure? What would you recommend for infrastructure for governance?
And I'd really, defer to Tatiana and the resources and things that they've already developed. I referenced the NACO document that early on I thought was helpful in terms of, they said, because it was also interesting in some of these early presentations, I did, said, how many of you in the audience, have like prohibitions on even using AI? And, a lot of hands went up. And certainly you can understand, okay, you can't load these onto government computers or something, but how do they prevent someone, having it on their iPhone or their personal phone or something like that? And, what I liked early on about the NACO toolkit was that it wasn't say, don't prohibit this, but put the appropriate guardrails in place as you're moving. And, so we've talked about in terms, the high level, just talking, making sure privacy controls, human oversight, bias auditing, those sort of things are just some of the high level governance aspects. And I defer to Tatiana because they've really developed these tools also that can help health departments.
Yeah, Tatiana, I'll turn it over to you, and maybe you could reference a little bit more thoroughly the NACO guidelines. Are you familiar with them?
I am familiar with them, but maybe before I jump to them, are you okay if I talk about a little bit the governance framework of?
Please.
All right, thank you. So a couple things about thinking about how you can develop a policy, which is a part of AI governance framework, is what we have seen worked well in organizations is setting up cross-functional AI working group. And you do need to think through all the different divisions, all the different roles that individuals play, so they can be part of that conversation to help inform your AI policy or AI governance structure. We also have seen it's been successful when you have HR, legal, program leads, IT as well as a part of this. And so policy is not just one person sitting at the table and, in like a desktop exercise and putting it together. It should be really fleshed out across the different divisions and bring different perspectives to the table. As a part of that, it could also be helpful to assess your organizational AI readiness, and that can be done through the survey to your staff, asking in different domains about what they have been using tools, what is their comfort, what is their knowledge. There's actually some validated questions on the AI readiness assessment that can be used, but also asking what they would like to see in the policy. And why it's really important, because AI can really feel uncomfortable for leadership or staff in some ways. And so fleshing out those particular issues is going to really help to inform your policy development. And then we talked about building kind of the knowledge. And so all of that builds up to developing the framework for AI policy development. So then it's really important to decide on the right policy structure for your policy. So operational or governance or enforcement, this really thinking about where you want to center. So some of the, for example, governance model of AI policy development, where you really start with who is going to be in charge of, enforcing the policy and how it's going to work out, versus operational, where you have more details about how the workflow in the AI, procurement and other aspects will be structured. I also want to highlight the importance of structuring AI policy by risk level, and actually also by the type of AI systems. And let me show you what that structure of risk-based framework could look like and the reasons. And so as we know, AI evolves, AI tools, AI systems evolve, and use cases change. And so what we have seen is if you structure it by risk-based level, and you can determine how you determine low, medium, and high risks, then your use cases can fall really within those categories. So you can really successfully balance between securing some very important, privacy, transparency, bias mitigation, while at the same time allowing for, some of that experimentation. And this model of risk-based also allows to proportionally assign the needed oversight to the risk level. So for example, if you're low risk level, it's typically internal administrative operational tasks. So in your policy, you will define what oversight and what other strategies would need it to really address some of the concerns for the low risk level, which usually be minimal. It's usually, the staff will kind of self-check and rely on that. But then we move into the medium risk, and that's where you have potentially use cases that will fall under this medium risk is to support public-facing work. They might indirectly influence decision or programs on communication, where you need to put in your policy additional layers of oversight, and even how that's going to be, which tools can you even use at publicly accessible tools versus using the procured tools or certain kind of security measures. And then, of course, when moving to the high risk part of the policy, that will you put additional structure in your policy about all the different protections that needs to happen for if you use it for the tasks that fall under the high risks. And so in addition to differentiating between those risk-based framework, in your policy, you can consider also differentiating between AI systems that are publicly accessible versus those who are procured. But even with the procured one, just because, the tool's been purchased, it doesn't mean that it might meet all the securities that your organization needs based on the use case. So you can differentiate in your policy framework is that, like, for example, publicly accessible tools can only be used for low risk cases, where procured tools, of course, are preferred, but definitely a must for high risk, but also after this tool be clarified or cleared for using for that case. So I just want to bring up this important differentiation as well. But the type of concerns that typically we're trying to address with in a governance policy is thinking about hallucinations or confabulations. That's been the term that's been emerging in public health, and basically meaning that AI systems can produce outputs that are wrong or have an errors. And because, AI is not a source of truth, the AI systems are based on predictions. And so in that case, they can create some of those errors. So in your policy, it would be really important to pay attention how you will do oversight, the oversight section that addressing those hallucinations. Bias. We know AI system can produce bias. And so because they are trained, depending on what data they are trained and how this information is, how the model is being developed, what algorithms are being used. And so really important that the policy also treats, the bias section. So it's from detection of the bias to put in there how the outputs will be reviewed, how they're going to be checked with the experts, and again, depending on that risk level. And then you have data privacy risks. This is very important, especially for public health organizations. In that case, a lot of AI policies would definitely have a section on data privacy risks and vary by the risk level. And so for low risk, no data, they would have no publicly data that will be input in the system. But then if it is used for moderate or even high risk, it needs to make sure that the questions are asked of the vendor. And it should be in the policy how procurement will happen, what type of things that the systems will be checked for. One thing I want to highlight that as we were working with organizations, there seems to be still that need for additional capacity of how to work with the vendor, what questions to ask about their AI systems, who will do this risk-based assessment, because not every department has maybe a robust IT system. So we need to think about that cost sharing capacities that might be helpful. And then we know another thing that needs to be addressed about transparency and explainability, not AI systems, here being them referred as the black boxes. It might be less important as a feature if you are, summarizing minutes for using generative AI. But if you're making more decisions on that that could include eligibility or services or resources using AI systems, it needs to be spelled out in that governance structure. And of course, copyright concerns and overrelying. So copyright concerns, you need to really put in your governance structure of your policy is how, looking at the system to make sure that it's not trained on copyrighted materials. And again, if you're procuring the system, that can be a question that can be asked of the vendor, particularly. So this is just some of the thoughts about the governance framework, but typically your policy would include, starting with the purpose statement, guiding principles, and then what you really try to secure with this policy, and then really jump into, this risk-based system, and then specifically spell out each of those: bias, transparency, data privacy, cybersecurity, and all of those sections, and also who within the organization can support that oversight.
That is really, really helpful, Tatiana. I know that the NACO guidelines have been mentioned not just in our webinar today, but I've seen presentations that reference them. So I wonder if you could just talk a little bit about who NACO is and where people could go to find the guidelines as well, as just another reference.
I mean, I'll mention it. It was the National Association of County Officials. It was probably produced about a year ago now, and has a toolkit. Again, some of the guiding principles from that, be agile, flexible, be creative, and think big. Set the outcomes that you want to achieve for your county and community. Identify and evaluating use cases. Being proactive and not reactive. But approach it, utilization with guardrails and guidelines specifically, rather than saying we won't allow or implement AI or Gen AI, and that was one of the things. But maintaining that vigilance when it comes to accuracy, privacy, bias, and ethical challenges, and communicating how it can bring positive change to the workforce and address challenges up front. And then establishing those functional requirements for implementing the systems that include strong data and governance measures. But one thing, there's also a comment in the questions that's saying, oh, this sounds good, but we're talking about from health departments with huge budgets. And I really want to mention, as Tatiana was talking about that risk levels and the low risk level items that, that just informational and internal administrative and operational tasks, that is not expensive. And this is where, from the start, all of these I've said, if you haven't, ChatGPT is very affordable, usable, and you can start using it today if you already haven't. And it can be so powerful to just, and again, Tatiana and their team have great trainings on how to do the queries and prompts and things for ChatGPT to get the best answers and hone it down to what you're really wanting. But you can do that today. Anyone, any size health department, because I work with NACO, and we're trying to think of this for all size health departments, not just large, but the county health departments in Texas. We've got a lot of small counties, and that's exactly we're trying to. How do we make this applicable to everyone? And it is totally accessible to every size health department right now.
Yeah, and I think it's also accessible, and there are many, many applications for community health centers and other kinds of agencies that are working in one way or another in public health. And one of the reasons I thought this was such an exciting opportunity to bring the two of you together in this conversation is that, Phil, you can give us so many such a great array of where you have in your large health department found some use cases that really work out. Tatiana, you've had the opportunity of working across the country with all kinds of organizations, types and sizes, and and different work that they're doing. And I think that between your website and the tools that are available there, plus the kinds of areas that you've brought up, Phil, and this webinar will be archived. Anybody who's listening will be able to come back, find the slides, find the information, get the references, and hopefully hone down to figure out what works for them and right size it for where they are, wherever it is that they're working. So this is, at least it's an overview. It's a link to lots of resources, but there's a lot of stuff out there that's already been done that people can just sort of take off the shelf and start to think about whether a particular area applies to their needs. So I think that's a great overview with respect to some governance issues, and I want to get into a couple of other issues that have been raised by the audience that have to do with some special caution. And so I think that there are areas where both of you have found that there are areas where you would tread more lightly or maybe not go. So given where you are so far in your both in your training, Tatiana, and all the people that you talk to, and Phil, in your health department, what are the areas where you want to say, maybe we're just not ready to go there yet? AI is still a little bit in development, and we don't know everything we need to know yet. So perhaps you'd like to comment on that. And why don't we start with you, Phil?
Yeah, I mean, and as I said, it's still in our we're in our infancy with this. So we're still at, trying to take advantage the best we can with some of the low risk type of opportunities. I think that as we get into actually those higher risk categories that Tatiana mentioned, we're really using the data and depending on the data for resource allocation or other things like that. That's where we certainly want to make sure that the biases and other aspects are well accounted for and understood. And then just the other big concern that we have is with the privacy aspects and really ensuring that any systems that we're using, again, we're working with our county IT to have more access to these closed LLMs that we can control what is in it, and it's not publicly available. We are also implementing our electronic health record with our county hospital system in Dallas. It's Parkland Hospital, so we have Epic, and so there are other applications and things that we're really looking at, to record the visit encounters and populate the electronic health records with that information, or for X-rays and other reading those X-rays for our TB patients, and the preliminary data on all of that looks really good in terms of how they can help all of us, and keeping that human in the loop will be important for those. But those are some things that we certainly want to be cautious as we move to clinical decision making or other things like that, and they're tools to help us with some of these things.
Tatiana?
So if Dr. Rice will allow me to deviate for a second, and I'll get back to that question, because I saw also the question about the tools that people are thinking about that cost effective. There are some cost effective solutions, and there are actually so many different tools. The problem will be to sort through them. So for example, Pedal AI is the one tool that can help with literature reviews, and it's relatively cost effective. Even the Pocket Talk from working and talking to a health department, which is a smaller in size, seem to be also not very expensive tool. There are, of course, free versions of ChatGPT and Copilot as well. So there are also Gamma. Gamma is one of the tools that can allow to generate your presentation within seconds. There's a free version and there is some sophisticated. So I guess there are some tools that do exist. I know we talked about some bigger public health applications because we also want to kind of dream what's possible, but there are also a good suite of tools that can take you in your kind of daily operations. So hopefully that helps if I know somebody just had that question. But thinking about where we don't want to use AI, have to be specifically cautious. I think where some of the things that we have seen is decision making and eligibility determination. So specifically where AI can influence who gets the services, who gets the benefits, who gets resources. And because it's really potential for that bias in algorithms and also bias in the data, how it's being trained. And so, but that said, we're not saying you shouldn't use it for that particular case. It just has to go with the human oversight, appeal process, and also kind of testing for fairness. We also saw some states actually put in some particular policies in place. Like in New York, they put that requires state agencies to perform assessment of any software that's used for algorithms for affecting benefits. We also saw legislation in Montana that for prohibiting government entities from using AI for behavioral manipulation or discriminatory classification. So again, this is just one of the things that we need to be cautious about. Another one is the systems when they're used for like figuring out who might be high-risk individuals, maybe those who miss appointments or those who might be vaccination hesitant. So if you're trying to use AI systems for that purposes, it could potentially have that stigmatization, profiling, incorrect labeling. And it's just because there are so many considerations when it goes into what affects that. For example, who is vaccine hesitant? It has a historical aspect. So really using AI system to project based on certain, data might introduce error. So again, just some application where it has to be more carefully approached and looked at the system to make sure that you understand how the model was designed, how it was trained. And then publicly facing chatbots. I think there has been some raising concerns about chatbots that can create AI-induced psychosis. And this is not really the community, provider community did not have enough, evidence yet to declare that kind of that it's related to AI, but it's more cases that we have seen when individuals, especially with mental health vulnerabilities, can develop stronger attachments to chatbots, and they believe that AI is sentient, that it has communicating specific messages and maybe reinforcing delusions. And so if AI chatbots are used for clinical setting, it has to really come with appropriate kind of guardrails and making sure that it is not kind of deepening that hallucination or isolations. And so just kind of those three that I want to bring to attention about some caution.
That's super helpful. Again, if audience has more specific issues you want to raise, please do. A couple of things that came up in the conversation with the audience. I wonder if you could talk a little bit about the concerns that public health workers might have as we start to have conversations about bringing AI tools into the workplace. People are going to feel that their jobs are being replaced, that they will be, that they'll be shooted out of their positions because a machine is taking over. Can you talk a little bit about whether you think that is a real concern or where there are more opportunities to help staff to understand how to grow within an AI environment?
Yeah, I'll just say, I mean, right now, it's a tool that can help free up a lot of our staff to do some other, like for epidemiologists to do more important things and some tedious sort of administrative type of things so I think for us it seems like certainly it's a concern of employees, and we hear that, but that we've got plenty to do, that it's not like if they're able to use AI and free up some of that time, there's a lot of other things that go to that next level that we're now freeing up time to do, like whether it's developing more dashboards and rather than the EPIs just being tied up, again, with day-to-day stuff, they can start to do a lot of the things that we've wanted to do for a long time. And maybe there might be some administrative tasks or clerical other staff that some jobs might be, covered with AI. But again, I think we've never been that overstaffed that we can have something for them to do. I did see one question also specifically that I want to make sure and answer. Someone was asking what was the software that we were using with, or that Parkland has actually chosen to do the encounters and the notes from the patient encounter. And I think it's Ambient is the one that Parkland is using. So that's what we're going to be implementing.
So Tatiana, you've been to a lot of different organizations. What are you hearing about worker concern, and what are some of the strategies and discussions that are happening in order to help people take advantage of, rather than fear, the potential that AI might offer them?
Yes, excellent question. I think it's almost in three different levels. So for workers, for staff, and build on something that Philip said in terms of there is a concern, there is some concern, it could be not concern about would that be a replacement of their duties or their responsibilities. So really framing in the way that I think Philip said, framing that these tools are to augment and not to replace the workforce. But with that really comes a responsibility, or maybe that organization can embrace this responsibility of the training. So really creating that, professional development opportunities for the staff to learn not just about general AI, but how AI aligns with their specific job functions and how it can support those job functions. And it also comes with the clarity, can they use that? So one thing we are hearing, there's a lot of anxiety among workers trying, if they don't have an explicit policy in place, can they even use it? And that creates the idea that they actually like using it, maybe not sharing it or not fully utilizing their potential. And so that training and that clarity about how organization feels about using AI would be really important, but also giving again them very practical ideas and supporting that how they can be used. But we also need to be in a way like managing up with the leadership, because we're also hearing that staff are very concerned that leadership might not be in favor of them using AI. And so figuring out how we do that change management, as with all new technologies, it's also become an issue. But figuring out if you're working with your leadership is really frame that from the value perspective. How does it bring value to your work? And not just in terms of the time saving, but also in terms of quality that you can gain. And I saw the question in the chat earlier about what if you have to do a lot of, cross-checking and reviewing the outputs, and does it really bring a value? And in some cases, no, it wouldn't really bring a value if you do a lot of cross-checking. So if you're really trying to use publicly accessible tools to generate information, you really have to cross-check everything. So in that case, you can ask for source and you have to go to original source. But what it can do for you, you can generate you a list of potential sources that can be in one place, and you can go to those sources and generate information. So you can decide as you're trying those pilot cases where it does add value and where it doesn't add value. But then the other part of managing in terms of workers and leadership is staff is also community and partners. So once there is aware that maybe your organization is using AI, there might be some perceptions about that. So transparency is the best probably strategy, and figuring out how you really frame that. So saying like my department is using AI for those functions, but we also have human in the loop. We also check the information, but that's what allows our department to do. Like it allows us to spend less time on administrative stuff and more time to engage with the community. So thinking about that transparency piece with the community is another part of that kind of holistic approach.
And if I could tag on one thing, just the change management aspect is so important in everything, whether it's data modernization, implementation of AI, and adoption. And so, one of the things that getting the staff to even just try it. And what I've seen is once they see the potential and what this stuff does, again, so many people had not even tried and downloaded ChatGPT, but once you start playing around with this thing, people start to get the opportunities and how this can really change so much of what we do. And so we get a lot of excitement, but it takes that, so a lot of people are sometimes afraid of change, and it's how we deal with that at change management with any issue. But I mean, I see a lot of the people just really get excited, and that's what we want also. And especially in some of the young people coming into our department, it's really exciting. That's what retains the people, that they see we're trying to use these new tools and are excited about the things that we're able to do with this.
So I want to switch gears a little bit here and talk and get both of you to talk about the issue of bias, because it's come up in all of the discussions we've had about AI. What are the kinds of approaches that you think about instituting with your staff as a regular procedure in order for people to become more aware of the bias issues and to mitigate some of the bias issues that can occur because we're using AI? Phil?
Well, again, on this one, I'd probably defer to Tatiana, but the big thing for us is keeping that human in the loop. And, also when we can control the data and the data sources that we're inputting or training with the training of the AI or in a closed LLM or something, being conscious of what are the limitations of particular studies or other information that's going in. But the first check for everything for us is, keeping that human in the loop to evaluate and be conscious of potential biases as we're looking at, what information are we getting out, and what we need to be concerned about. But again, I probably from a systematic standpoint, defer totally to Tatiana and what they're recommending on that.
Okay,
So
Tatiana,
great.
here's the pitch.
Great observations, Phil. Thank you. So the way to think about bias, there are basically two levels. One is that you can have control over, and the ones, as Philip said, you can have control over. And so the ones that are you don't have control over is the one that you use in the system. So you don't know what biases are present. You don't know what the data has been trained on. So it's for available, public accessible systems where you cannot really ask those questions. And so in that case, if you're using those systems, first, I think the rule of thumb is not to ask any questions that you don't know, that you cannot check the information for. And so you have to just really maybe query something that is you're an expert, and you will cross-check. If you're ended up using this information, it's important to make sure you have an expert on staff and somebody else to be able to check it to make sure there are no biases in that. Another piece is when you do prompting, and prompting is basically asking the system of generative AI any questions to make sure you don't introduce the bias yourself. And so, thinking about having that self-check is saying that you have a neutral prompt. So the neutral prompt would be to say, provide me all the different, information about what could be potential implications of, AI environmental health impacts, versus having a prompt that says AI could generate this negative or this positive environmental impacts and give me the data. So making sure that you're not introducing that in the prompts as well. And then as well as thinking about interpretation bias. So when the AI, system comes with the outputs, that you're checking it for interpretation and making sure that you're not interpreted wrong the outputs that you have received from the system. But if you're working with a vendor, you have more of a kind of power to ask those questions. So then you can ask a part of your protocols when you're in your procurement to ask the vendor how the system's been trained on what data, how they actually mitigate the biases in their data, how they continuously, because the system might get updates, how they continuously are keeping an eye of that and doing those bias mitigation techniques. So in that case, with the system procurement, you have more latitude to ask those questions. But bringing that training on the bias to your staff and making sure that everybody is aware of what type of biases exist, what they can do, and then also bringing this in your contractual and procurement state for the systems could create that kind of system level approach for your organization.
That's those are super good steps for all of us to be thinking about when we think about bias, and I appreciate that. And just to the audience again, all of this will be recorded. You can download it at another time, and you can, at your leisure, ponder through the points that our speakers are bringing up, because I know this is a huge amount of information. It's drinking from the fire hose, and you don't want to drown here. So one of the concerns that's come up over and over and over again, and just this morning I heard a really thought-provoking op-ed is on the issue of the environmental impact of AI. So we work in public health. The environment, the concerns about the environment are definitely a part of our sphere. This is a part of what we are responsible for. And so I want to ask each of you to share your thoughts about the environmental impacts of AI and what we should, as both public health workers and public health advocates, be thinking about as we advance our departments, our work in the area of using AI. Tatiana, why don't you go first this time?
Thank you. Very important question, and a lot for public health to navigate. When we're doing trainings and capacity building, this question always comes up, and it's very important on the minds, as you said, Dr. Navarez, on the minds of public health community. And so this area is still in development. However, we do know that there are those AI systems do use water, they use resources. They also put some strain on energy grids, which require the updates, and that could result in additional cost on the utilities that will be passed over to the communities. We also know that the data centers and the infrastructure that come to the communities can also in a lot of cases come in the communities that already have conditions that are not, conducive to spending extra water or extra energy on those systems, and they can create those, disparate impacts. And so the question is what we can do. Some particular ideally, it would be great for public health to have a seat at the table with the developers to continue pursuing that approach. Also, that maybe in a procurement, it could be good strategy to ask the vendors how much energy their system uses, and if they can be transparent about that, and what strategies they do to mitigate or offset those particular carbon footprint. There are some companies that have been, transparent about that and sharing that information, what they do to offset those technologies. And other things in environmental, maybe, and that's when it gets tricky. We kind of want to get comfortable with using the systems. So I almost don't want to say don't use it for trivial tasks, but at the same time, it's very tricky. If you don't use it for small tasks, you might not, get comfortable with the system. But if you can, use it for more, sophisticated tasks that really can support your work, for not really, fun activities, because it is using energy with every prompt you put. And so that's just a couple thoughts I have here, but I want to make sure that Phil has the time as well to answer that question. Philip,
Yeah.
sorry.
Yeah, no, I really don't have much to add. I mean, I don't know, what information there is on, low resource models versus others or other things. I mean, I saw something, I don't know if it's true. They said if you add thanks or please in your prompt, it's costing a lot of extra money and probably using more resources. But, being judicious in the, as you said, Tatiana, the, what you're asking for, not trivial thing, or, making sure that you're using it appropriately, not unnecessarily. But it's definitely something that we all, especially in public health, have concerns about.
It seems to me that as public health professionals, this is part of the equation. Whenever we do anything that uses resources, particularly anything like AI, which at least in its infancy is setting up a massive industry of developing data centers. I think we need to think about that, and I think we need to bring that up, and I think we need to, consider that as part of the equation. It's still part of the equation. It's not. It might not be the roadblock that says stop. We're not going to do this anymore, because I think that would be a mistake. But it needs to be part of the public discussion. And that's, for public health professionals, it's just still part of our job. So it's also part of our job to educate ourselves as much as we can on what the energy requirements are and what the impacts are down the line, and to talk about it. That's just part of the job. So I just really want to thank both of you. I think you've just shared so much information and so many tools and resources, and just remind our audience that everything in about a week, the recording, the slides, the transcripts will be available at dialogueforhealth.org. So don't forget about that. Come back. You can download this presentation at that time. You can share it and have discussions with your staff or your colleagues in order to see what people, what kinds of thoughts and reactions they have. And if you have any future thoughts for us about what to include in our work going forward on this topic, please do. Now, last thing, in mid-January, we're going to do a workshop with Dr. Tomas Aragon, who is a former state health officer for California and a very excellent expert in this area. And he'll actually spend some serious time helping people to think about what are the applications, how can they use it, what do the tools look like, how do we work with those tools. So hopefully, if you've seen the first two, and the first one is already archived and up, then you'll have some background in which to get a little bit of hands-on education with Dr. Aragon. So thank you to both of our speakers, and see you next time. Bye-bye.